All right, good evening, everyone. Welcome to our fifth town hall. This one is regarding opening Ohio, ending the business restrictions, the lockdowns, and having a discussion with you tonight. We're nearing the 1 year anniversary of the mass shutdowns and closures in the state. We're glad you all joined us tonight. I'm sure the crowd will build as we go through the introductions here. So without wasting any more time, welcome one of our hosts tonight, former Congressman Jim Renacci.
Well, thank you, Tom, and thank you everyone for being on our fifth town hall tonight. You know, people say to me, we're hoping you get out. We want to see you in the different counties. We're going to start doing that, but I got to tell you right now, we're able to get to almost 700 people on these Zoom calls, and we're going to give you an opportunity to answer questions. We're going to talk a little bit about some of the facts and statistics for the first half hour, and then give you that opportunity to ask as many questions or even comments too. Again, this is how we learn. Um, Before I introduce one of the other panelists tonight, I want to tell you a little bit about myself. For those that don't know me, and again, many times people say, I heard the name, but I don't really remember Jim Renacci. Look, I ran statewide in 2018 against Sherrod Brown, so people got to know me there. But a little bit about my background. Look, I came to Ohio 38 years ago because Ohio was the land of opportunity. Think of some of the places and businesses we used to have here. Think of all the rubber companies in Akron, all the steel mills in Cleveland. Think of NCR down in Dayton. Think of all the business opportunities we had across the state that have now since gone over the last 38 years. And in many ways, the American dream is gone. But I can tell you, 38 years ago, this was the place to start the American dream. I came here, moved here from a blue collar union family out of Western Pennsylvania, um, married my childhood sweetheart who came here 38 years with me as well. And look, I started my first business at the age of 24, went from one business to 60 businesses, created 1,500 jobs, and employed over 3,000 people. I had businesses all across the state, so I understood what every part of this state was about, whether it was, some of the smaller counties, some of the smaller cities, or some of the larger cities. I had businesses throughout the state, and I got to know Ohio from the grassroots to the urban areas. I would still be in business, quite frankly, if in 2009, one of my businesses, a Chevy dealership, wasn't taken from me by the federal government. Now, people say, well, how did that happen? And remember, you got to think back. In 2009, federal government took over General Motors, and then the federal government told General Motors, we're going to decide which businesses are essential and which businesses aren't essential. So we're going to talk a little bit about that tonight, where the state and the governor, DeWine, comes in early on with the lockdowns and shutdowns and says, your business is essential, your business isn't essential. I lived through that. They basically told me my business wasn't essential. And you know what that meant? That meant the 58 employees that I had weren't essential either. And I'm not too sure they were happy about that. And I had built this business, one of my many businesses, and I had an agreement with General Motors to actually grow it and move it out on the highway. I never got that chance because the government decided that my business was not essential anymore. And they basically shuttered my business. I called my US congressman and asked him for help. I found out not only was he not going to help me, he lied to me like many politicians. He told me he would help. He didn't. As soon as I found out that he voted against my dealership being reinstated, I called him and told him, not only are you somebody that I can't trust and are a liar, but I'm going to remove you from that office. And quite frankly, I jumped into a national race. 14 months later, I became the US congressman in the 16th district. While in Congress, look, I had always believed in the idea of smaller government. I was a principled conservative, and I also believed that we had to reduce the size of government. I quickly was able to serve on the Financial Services Committee, became a member of the most powerful committee in Washington, the Ways and Means Committee, and was actually one of the architects of the Tax Cut and Jobs bill that President Trump was able to get signed into law while I was there. But here's what I would tell you. After 6 years, I realized that Washington was so broken that we were never going to be able to fix it. And to fix it, we had to come back to Ohio. I personally believed I needed to come back to Ohio and get out of Washington because, as you saw today, the president signed a $1.9 trillion bill that is just spending our children and grandchildren's money, just spending it away. I don't know who's ever going to pay for this. Think about this. $6 trillion has been spent now in COVID relief in the last year. We are never going to fix the federal side, but we better fix the state side. And that's when I formed in 2009, Ohio's Future Foundation, who is sponsoring this event tonight, and said, we need to get back to Ohio and we need to figure out how to change things. We have been highlighting issues that have cost Ohio jobs and opportunities for the last 15 or 20 years. Again, it wasn't just the Republican Party, it was also the Democratic Party that put us in this process of maintenance and maintaining the status quo while other states were changing. Ohio's Future Foundation has shined some light on some of these issues, and hopefully tonight we're going to shine a light on what our government in Ohio has done to really hurt our economy. But before we go on into some of our statistics and slides, I want to introduce a friend, Jack Windsor, who is also going to be a panelist tonight to talk about some of the issues about Ohio, the closures, and some of the problems with what's happened over the last year.
Hi, Jim, thank you for choosing me to participate tonight. And Tom, thank you for all of your work on this endeavor. And thank you everyone who chose to invest time tonight to tune in. You know, I'll never forget sitting at dinner with my girlfriend and reading an alert that Governor DeWine barred visitors from attending the 2020 Arnold Classic. 6 days later, DeWine issued a state of emergency saying, quote, I would not read too much into the state of emergency. It enables us to do a few things in government that we couldn't have done, particularly procure some hospital equipment. 1 year later, Ohio is still under a state of emergency, and COVID-related orders and rules that apply to schools, nursing homes, sports, entertainment, businesses, vaccinations, social interactions, almost every area of our lives, they're still in place. But lodged somewhere between the Arnold and the state of emergency that still exists is a year unlike one I've ever witnessed in my life. Capsuling it to, and honing in on it quickly would be impossible. We could spend hours talking about everything that's taken place in the last year and probably write several books. But a few moments stick out in my mind. I remember on March 16th when Acton DeWine, Husted, and Secretary of State LaRose canceled the next day's primary election, first trying to do it in the courts, but failing to get a ruling in Franklin County. So instead, the health department issued an order. I remember DeWine's swift and decisive action. I loved that. We responded quickly. And I also remember thinking that he wasn't in an enviable position. Not only was he trying to mitigate a virus, he and his administration took it upon themselves to act on behalf of almost 11.7 million Ohioans. His approval rating was about 90%. So everyone was on board. Seemingly everyone complied, shutting down their businesses, staying at home. The projection is 62,000 cases per day without mitigation. That wasn't in the ballpark. I remember that. Projections of 10,000 cases with mitigation also missed the mark exponentially. The final projection was around 2,000 cases a day if Ohioans followed measures that, they did, and cases were around 300 to 400. That's what was being reported a day per day back then. Hospitals didn't get flooded, yet the 2 weeks extended. Consequently, some people, including lawmakers who spoke with me privately, wondered why, given information we had from China, Northern Italy, New York, why we weren't laser focused. We knew our oldest and those with comorbidities were at greatest risk, yet our focus didn't seem to be on the smaller, more vulnerable segment of the population, our elderly and congregate care settings. And then in May, Dr. Acton guessed that 20% of deaths were coming from nursing homes. A reporter challenged her on that and pointed out that number was more than double the amount, and deeper digging uncovered that it was closer to 70%. We also had evidence of the effects of shutdowns that occurred during SARS and the mental and emotional toll of a 2-week shutdown that happened after that. We had data on layoffs during the financial crisis of 2009, not only the economic effects, but suicide spikes, drug and alcohol problems, and mental health crisis. Despite the success in other countries with sending kids back to school and the CDC director saying there was no evidence to support the notion that kids were extending the transmission of COVID, we kept our schools closed. And school closures created severe disruptions to learning and mental health crisis. Reports telling the story of the 15 Mason, Ohio students who were hospitalized for suicide ideation and the 84 Hilliard students who were hospitalized for mental health issues. These are the stories that not only stick out, but really hit home to me. Those in the report released by the Journal of American Medical Association showing that a 54-day disruption in learning would result in a loss of 13.8 million years of life in our 5 to 11-year-olds across a 24.2 million group of school children in that age range in the United States. And then we used our one-time tools, those lockdowns and those stay-at-home orders, when numbers didn't jive with the decision to lock down and stay at home. But those are things, given their severe impact on the entire population, not just the sick, that you can only do once. So come fall, which is when other coronaviruses are notoriously more contagious and deadly. And by the way, I'm not a doctor. It's just what epidemiologists and doctors have told me. We didn't have that tool in our tool belt. But as we just discussed, restrictions on every area of life began to choke out businesses, harm our kids. And then there was this steady resistance building over the course of the year. And then, the numbers, Jim, are another story we won't go into tonight because they are a powder keg for controversy. But the numbers in Ohio show us we've logged almost 1 million cases. We've admitted about 50,000 people to hospitals. And tragically, we've lost over 17,000 lives. So a year into this, we seem to have somewhat weathered the storm with lots of damage. It seems we missed the projection, though, that 70% would be infected and the death rate across the entire population would be 20 times higher than the flu, thankfully. Now we see areas that were more lax, seemingly no worse off than areas that were more strict, like Ohio, where we were swift and strict and have now been mandated for a year. But mandates, we've been told, for example, by Senator Terry Johnson, who's a combat medic and a doctor, who argued in his speech in support of Senate Bill 22 a few weeks back that trying to stop the virus is like standing by the ocean and trying to stop a tide or trying to grasp and stop the wind. And I think that's the question that we'll wrestle with and maybe find an answer to over the next year or maybe several years. What was the total cost of what we did? Did we save more lives or did we take more lives? Did we have secondary and tertiary effects that could have been avoided?
Well, thank you, Jack. Why don't we move on to our next slide? Look, again, we're going to give you some statistics and facts moving forward. We're going to talk about some of these issues and then we're going to open it up for your questions. But let's talk about job losses first. This was significant. Now, I will also tell you, 2019, this was prior to COVID. Ohio was already going in the wrong direction. We lost 6,200 jobs in total in the state of Ohio in 2019. That's before anybody even knew what COVID was. So clearly our policies and practices, and many of the practices and policies of bringing business and jobs to Ohio weren't working even in 2019, the first year of the Dwayne Newstead, leadership in the state of Ohio. But then all of a sudden, COVID hits. And COVID takes these numbers significantly down. And as you can see, there were 5.5 million people employed in March of 2020. We lost almost 1 million jobs between March and April. Employment has come back some since then, but we still have lost a significant amount of jobs, many of which will never come back. And prior to March, employment figures were closer to 6 million. The decline began in February. There's another example, though, of lockdowns, shutdowns, all of these things that caused many, many other ramifications. Ohio was warned in 2019 that their unemployment system was not going to be able to handle by the federal government in February of 2019 and by the Legislative Service Commission in September 2019. Our unemployment system was fragile. The systems were not strong enough, and it was underfunded. And even the slightest downturn in the economy would cause us significant problems. Nobody in leadership decided to put any credence or even effort into fixing our unemployment system. And today, our unemployment system is collapsing. We have 668 unemployment claims, 74,000 fraudulent claims, 330 million in fraudulent claims, 330 million. Can you imagine what those dollars could be used for if they weren't fraudulent claims? 7 million a day now being borrowed to cover the costs of the problems we're having with our unemployment system, and over $300 million in interest because our system was underfunded and ill prepared for even the downturn. This is a side effect of the shutdown, but it's also a very expensive side effect. Think about the numbers I just gave you, almost $700 million being wasted because we were not prepared for the unemployment that we got because of the shutdowns and the restrictions. Jack, do you want to add anything to that?
That was a really in-depth analysis, Jim. And I think back to what I've heard. I'm in a really neat position where I have a chance to read questions, take calls, and go forward and ask those questions to our government leaders and try to write meaningful reports that explain things. And some things that I heard regarding job loss over the last year, I'll go to the marrow of it. The deep issue that I've heard a lot about from the beginning was the government decided which business was essential and which business wasn't essential. And that is something that I think Ohioans have wrestled with from the beginning. And, you already hit unemployment over the course of 1 year was higher than it was in the previous 5 years combined, and it completely overwhelmed the system. And I had a chance to report on the $330 million loss in the pandemic unemployment assistance dollars that flowed from the federal level through the Ohio Department of Job and Family Services. Some sources tell me that number is going to go way north, but we haven't been able to, confirm all of those numbers yet. But, the other thing that's really disheartening, I've heard a couple of stories over the past few weeks where there were, the pandemic unemployment assistance program, for example, was intended for people who didn't otherwise qualify for normal unemployment insurance. And there are people that are self-employed, part of the gig economy. And one woman called me and said, "Hey, I filled out the paperwork and I received the money that they offered, and now they're trying to claw it back." And, I don't know that that's always with, PUA or other traditional state monies, but the message that I keep hearing back is that, well, wait a minute, it took me a long time to get it, and I was in a lurch for a few months, but now I'm having to pay back $5,000 or $10,000, and it has put a tremendous amount of pressure on the workforce, particularly mom and pop shops and the companies and the people that are really the backbone of our economy.
It's funny, Jack. I had a phone call one day from somebody who said, "You're not going to believe this. I never applied for unemployment, but yet I just got granted unemployment." And I said, "Wow." I said, "What did you do?" They said, "Well, I called Lieutenant Governor and he told me, look, we have a bunch of fraud. We can't keep up with it. There's a real issue." And I thought, that's not a good answer. Wouldn't you know, the next day I got unemployment. I got notice that I got unemployment. And I still remember I called the company, that one of the companies I work for where I get a paycheck, and they said, "Yeah, we are processing so many fraudulent claims." And I said, "Well, isn't it amazing? Jim Renacci, who has never applied for unemployment in his entire career, gets approved for unemployment in the Ohio system." It shows you how much fraud there really is in our system. It's definitely going to be an issue that's going to continue to grow. And I heard you say go north. It will continue to go north because we continue to have these problems until we open up. And it's one of the reasons why we need to open up sooner. You want to go to the next slide? Losses, projected actual permanent business closures. It's interesting. 60% of restaurant owners who responded to the poll by the Ohio Restaurant Association said they will close in April if help doesn't arrive. 90% said they didn't break even in 2020. I can tell you, I told you I had 60 businesses. I was a restaurant and bar owner. That was one of my businesses. It's interesting. Um, the restaurant and bar business does best in the evenings. The bar business does best after 9 o'clock at night. Think about when the curfew came on at 10 o'clock, where the governor said, we're going to put a curfew at 10 o'clock at night. Now, I know he's since released that, but releasing it today doesn't fix all the problems in all the bars that really, the largest clientele that I used to have come into my bars and restaurants many times on a Friday and Saturday night was after 8 o'clock. And many times where you generated most of your revenue was after 10 o'clock. The answer was, and I heard this many times, well, it doesn't matter because we really want to stop the spread. What did these people do? They left the bar at 10 o'clock and just went back to homes. They had house parties. People are not going to stop doing what they're doing. And according to the National Restaurant Association, about 110,000 restaurants across the country have already closed permanently. I was reading the Columbus Dispatch said in Ohio, 4,000 restaurants have closed permanently. The real estate industry, another area, is also, starting to have problems with rent. These are all associated with shutdowns and close-ups and businesses not being able to make money. Jack, do you have any thoughts in this area?
I had the honor of reporting on a short documentary that came out a couple of weeks ago. Behindthemandates.com is where it resides. And that was put together by three friends who were sitting in the short north last spring and watching what was going on. And they said, you know what? We really need to tell the story of these businesses, these business suppliers, the waiters, the waitresses, the staff, the families, and help people understand really what they're going through. And what you just said reminded me of that. There were three restaurants, and then there was one hair salon featured in Behind the Mandates. And one of the business owners in Delaware, Ohio, said something that really struck me. He said, there's the impact of, and this isn't verbatim, but there's the impact of today, but then there's the impact that's going to come for years down the road. And we might be looking at a decade here, and we may never recover. And another restaurant owner talked about, not only was I closed, but I had just kicked off a new part of my business. And so, those growth projections go into funding other parts of the operation. And so not only were they shut down, there's this thing called opportunity cost. They lost the ability to grow, not just operate. And the thing that is really sad is it happened without any due process. It happened at the drop of a hat. And you mentioned particularly the restaurant industry, their margins are so thin anyway. And that's the one that we hear a lot about. But there are many other businesses out there as well who struggle with capacity restrictions and making sure that they're compliant.
Well, it's interesting. You just hit on something that's very important. Governor Kristi Noem, when she was in Ohio last year, said that when she was confronted with the issue of close downs, shutdowns, and COVID, she first went to her health department and they said, yes, we're going to have a problem. She went to her health systems and said, we have to be cautious. We don't overfill our beds. Then she went to our legal department and her attorney general and said, what are the legal ramifications? And he told her, look, you do not have the constitutional authority to shut down, close down, mandate, all of these things. So she took the Constitution first in front of all the other things. Now, I know this governor will say, and some of the other Democrat governors will say, we're trying to save lives. And we're going to talk a little bit about lives because we have a health crisis and we have an economic crisis. And both of those should have been managed together. But what this governor did is he hid behind the Department of Health, the director of the Department of Health, and used, in my opinion, the Department of Health to really cover for what he was trying to get done. And of course, Amy Acton is who he put in the forefront. Kind of interesting. I just heard today that there's a PAC set up to now have Amy Acton run for Senate. So this governor actually hoisted Amy Acton up to a political figure as well. But we also talked about this, Jack. Look at the dollars that are lost in revenue. Ohio, it's on the slides today. Ohio received 8.5 billion in stimulus dollars in 2020 just to help balance the budget. Just think if we weren't getting federal funds. The other big problem is Ohio's budget already relies on federal funds for about 23%. We talked about this in one of my other town halls. 23% of the money that Ohio uses to balance its budget is money that they take from the federal government. And now we've taken another 8.5 billion just to try and balance the budget. Most money received has no strings attached, so it's going to be used for bailouts and everything else. It's going to be used to balance the budget basically. And one of the problems is there's a true lack of transparency in 2020 and 21. It will continue to be a problem nationwide. I'm not sure many of these states need the money. I'm not sure Ohio probably did need the money because it was already failing. But in the end, Ohio could have started cutting back. And that's one of the biggest failures of Ohio in as far as leadership. They could have cut back, just like businesses had to do. Some of the businesses you talked about, they had to cut back staffing and employment and a whole bunch of things to make things survive. Not our state. And I know, Jack, you've done a lot with, overseeing what the state's been doing. Do you have any comments about this and some of the dollars that we're taking in?
Well, I'll keep it real simple. The first thing that comes to mind, I had a really smart professor back in college, an economics professor, and he was from Boston. I will never do the accent justice, but he used to say, there ain't no such thing as a free lunch. And he's right. You know, there's always a payor and a payee, and whether that's money or otherwise. And so when you talk about $8.5 billion, really what that is that's people who have paid money to a government, and they're redistributing that money. And then of course, the other challenge is that we know that money was pumped into the economy. And when that happens, yeah, I can't imagine what the inflationary pressure is going to be like, simply saying prices are going to go up. And that's a challenge. The other thing that I think about when you said Ohio is beholden to the federal government to the tune of 23% before 2020, there's an old wise saying that the rich rule over the poor and the borrower is servant to the lender. And when you are in servitude to a federal government, you have a lot less leeway and a lot less latitude to be able to operate and perform the way that you want to, even if you are in the governor's chair.
Well, it's interesting, and that's a topic for another day, but school funding, because we get money from the federal government, we have to follow their mandates. You're going to see a lot more mandates coming in from the Biden administration, that unless the Ohio can detach itself from this federal funding, this 23%, we're going to have problems. But let's talk a little bit about the mental health crisis. You touched on this. NBC reported, and it's not on our slide, but NBC reported that there's been a 24% increase in mental health problems with children ages 5 to 11. 5 to 11. So we haven't even touched that on our slide because of COVID and the lockdowns and the shutdowns. Mental health visits have also increased by 31% for 12 to 17-year-olds. It correlates the numbers seen during and after disaster events. The numbers proportion of mental health related ED visit provides crucial context for those finding and suggests that children's mental health warranted sufficient concern to visit, the EDs. And this is all because we shut down our schools. These kids, think about when you were in school or I was in school. Part of the education was, in many cases, was going to the classroom. I talked to a member of Congress who told me that his 11-year-old daughter, she sits at the computer, she's not real happy. But his 9-year-old son wants nothing to do with that computer. We're losing an entire year of education when we really know that statistically, those children were not at risk. Now, maybe the teachers, and I realize, but there were precautions that could have been done, and we could have spent money to make sure those precautions are taken care of. But the worst we haven't seen yet from these shutdowns, and some of this mental health issue will be part of it. Jack, I don't know if you have any comments on that.
Yeah, this has been something I've heard a lot about from our readers and from our listeners. this is a passion point. And I've had a chance to do a lot of cool things in life, but the single greatest role I play is Papa to my 8-year-old daughter. And so when we talk about the educational drop off and the disruption in education and how that has a longitudinal impact on not only the uptake of education, but literally how long somebody lives. That's what was, in the intro when I talked about that report from JAMA, that we're going to lose millions of years of additional life in our kids due to educational disruptions. And that's hard for me to wrap my mind around. But just like you, Jim, I learned a lot by being in the classroom. To be totally transparent, I learned more by being on the ball field. There was so much that I learned and appreciated about sports and extracurriculars growing up. Had I not had those early in life, who knows where I would be right now. And there have been parents who have said from the beginning, well, wait a minute, the CDC, who this is the expert organization that we're pointing to, and we're talking about distancing and masking and cleaning our surfaces. They're saying that there's no evidence that this virus is being transmitted through kids. So if teachers are at risk or they are in a certain category, instead of taking all the kids out of the classroom, why not temporarily hire a proctor and let the teacher pipe in from the video, and then the proctor be there with the children? And that's just one example. But these are the things I think we'll wrestle with for years down the road and go, well, why didn't we? Why didn't we? And I think one of the biggest frustrations that I hear from our readers is that whenever there were thoughts or opportunities to maybe do things a little bit better, when those things were raised, they were just met with smack, a smackdown, and people were really silenced. Almost intentionally, it felt like sometimes. And so the opportunity to have a really good engaged group dialogue about maybe how we could do this in a way that not only saved lives, but made sure that our kids could be at their best. I don't think we always had those conversations.
And before we take any questions, I do want to add one thing that is interesting too, the income tax. Ohio is one of 3 states that the cities rely on income tax. And if you look at the numbers, because of lockdowns and shutdowns, of the loss of revenue in our cities, that is all going to come due over the next 12 months. You're going to have cities that aren't able to survive. You're going to have cities that aren't able to continue to pay their bills. And how does a city function when many of the businesses, think about it, are based on employees who didn't even come to work in the city? They stayed at home in a area maybe that's not a tax jurisdiction of the city. We're going to have a total mess when it comes to city income tax. And we already know we have a mess with state income tax. One other issue, you may hear from politicians, we have an increase in revenue at the state. They do. It's in sales tax though, not an income tax. We have lost our income tax base. We have gained our sales tax base. Think about sales tax. That's people spending money. We are getting people who are using their money, whether it's federal PPP money, all these cash amounts that they're getting, they're still sitting at home and they're spending that money. There's why the sales tax is being driven up. But that's a false sense for the future. Somebody's going to have to fix this down the road. Somebody's going to be handed a mess when really things come full circle and Ohio doesn't have the revenue to move forward. So with that, why don't we open it up to some questions and maybe learn some things from our audience as well.
Yeah, we do. We have a ton of folks on this call tonight, and a couple dozen lined up here for questions already. So we're going to try to get through these as quickly as we can and get as many of you involved. First question tonight, Jack and Jim, is from John. John, go ahead.
Hey, Jack and Jim, how you guys doing tonight?
Hi, John.
John,
Great. Thanks for your question.
Hey, Jack. Hey, Jim, thanks for taking up this fight for us. Jim, I support you guys. Jack, I'm your man. I'm glad you're doing the investigative work you're doing. I'll make it short. Hey, Jim, as a business owner and a small business owner, I have took a major hit over this pandemic. I came out in the car here so I get away from my grandbaby. So sorry if you can't see me or see me right, but I have took a beating with no help from the government at all. Do you personally know anybody that has been affected by this and lost their job personally or lost their business personally because of this?
Well, John, thank you for that
go
question.
to both of you, but
No, John, thank you for
Yes,
the
sir, Jim.
question. And absolutely, I have heard from so many people across the state, but the most touching story and the one that brings tears to my eyes every time I think about it, and I mean this sincerely. I got a call from a woman in Wayne County who told me, she said, Congressman, I lost my job. She said, my husband lost his job. She says, the toughest thing for me right now is to realize I have two kids in college. We made good money, but I'm scared to death because I can't pay my mortgage anymore. I may lose my house. I can't pay my car payments anymore. I may lose my car. My kids, I'm afraid to tell them that I'm not sure I can pay for their college next year or help them in college next year. She said, and by the way, I had COVID. She goes, so did my husband. She said, I would take COVID 5 more times just to be able to pay my bills. Now, that's the kind of story that you hear across the state. I've had businesses tell me, Congressman, you don't understand. And I do. I was a business person. You don't understand what it's like not to be able to know how to pay your bills. And I said, well, the difference is I was a business guy. I do know what it's like not to be able to pay your bills. I do know what it's like. I remember staying up all weekend one time because I was afraid I was going to lose my business. But guess what? That was not a government inflicted shutdown. That was just a normal course of business. These are government inflicted shutdowns that are causing people to lose everything. And that's a real problem.
Great. Thanks for that question, John. Our next question is going to come from Mario.
Congressman, thank you for your time. Jack, pleasure to meet you. I'm Mario Innocenzi from Geauga County Conservative Club. My question's for Jack. Jack, what can you tell us about Senate Bill 22? Any updates, and how's that progressing right now?
Mario, thank you for the question. If you give me just a second here, I was just working on a story on Senate Bill 22. So yesterday, Senate Bill 22, it passed the House by a vote of 57 to 37. 5 Republicans didn't cast a vote for the bill. 1 Republican voted against the bill based on some constitutional hangups. And the Senate concurred on House changes. So it has passed and it will be sent to Governor DeWine. It may take a day or two, maybe for the clerk to get that over, but then there's that 10-day clock. So when he gets it, he can either sign it, veto it, or do nothing with it. And then after 10 days, it becomes a law. But what we heard was that he's likely to veto it. And Speaker Cupp has said he's absolutely positive he has the votes to override the bill. Senator Andrew Brenner, Republican in the district, 19th district, said that right now he believes they have 25 votes for the bill, and he doesn't see that changing. So that's critical for if you're looking at this bill from the angle of an override vote, because it would take 20 votes in the Senate. He says they have 25, and then Cupp says that he's absolutely positive that they'll have the 60 votes that they need. And frankly, if the 5 Republicans that didn't voted for the bill along partisan lines, that would take it to 62. So it looks like, unless there's a lot of log rolling going on, that it will, assuming it gets brought to the floor. That was the issue with Senate Bill 311 at the end of the 133rd General Assembly. It should pass. A couple of real quick, I'll try to breeze through this. There's a 90-day limit to declarations of health emergency unless the General Assembly chooses to extend. The General Assembly can act to rescind emergency declarations after 30 days with a concurrent resolution. Orders and agency rules can be rescinded immediately by a concurrent resolution of the House and Senate. Concurrent resolution is basically a simple majority vote in both chambers that, yep, we want to do away with this. It's not a law, so it doesn't require the governor to sign it. Ohioans who contest an order, they have their cases heard in their home counties instead of going to Franklin County. And then those who actually bring a suit, like we saw many throughout last summer, and they win, they are able to recoup legal fees and court costs. And then health departments cannot issue public health emergency orders or rules against a broad group or class of people. The bill defines quarantine and isolation and applies lockdown restrictions to people that are infected. Those would be the isolated ones, and then quarantine to those that are in direct contact with someone who's medically diagnosed. And then health orders, the one thing that people who were really conservative and wanted things to change quickly and have more oversight, health orders have no automatic expiration date, which is what they were going for. They were going for a 30-day expiration. But apparently there's a 120-day expiration already part of the Ohio Revised Code. But that's where Senate Bill 22 stands right now, according to some of the research I've been able to do over the past 24 hours.
By the way, just so for the listeners know that was a great explanation, but the simple thing is it restricts the governor's power to do what he did. And that's why you're going to have to keep a very close eye to see whether this governor vetoes it or not. He does not want to have his authority taken away from him. It'll be interesting. I'm glad to see the House and Senate finally stepped up. Tom, why don't you go to the next question?
Yeah, good. Jim, this question will start off with you. This is from Rich. Go ahead, Rich.
Thanks. There seems to be this us versus them situation going on with the mask mandates, mask wearing and social distancing. Why is that? Shouldn't this be a choice?
Well, you know what? Thanks, Rich. And I will tell you, I've encountered this multiple times. Look, I have a brand new grandson going on 8 months. Whenever I'm around my grandson, I wear a mask. And people see me on Facebook and they say, shame on you. In fact, they call me a rhino. I had to chuckle because when somebody called me a rhino, I contacted them directly and said, why am I a rhino? Well, it's because you're wearing a mask. You hit the nail on the head. It should be about choice. The government shouldn't tell you you have to wear a mask. You should have the right to wear a mask if you believe it protects you. And even if people don't believe it protects you, it's your right to wear it. And for those who don't want to wear it, it's their right not to wear it. We do have this, which I hate to say is those that say anybody that wears a mask is wrong. No, 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 no. Anybody who violates and takes your rights away is wrong. You have the right to wear a mask and you have the right not to wear a mask. You have the right to social distance and you have the right not to social distance. If you're a private business, you should have that same right. Private businesses should be able to say, I want you to wear a mask or I don't want you to wear a mask. That's where I think we got to quit this, having sides, because in the end, it's about not having mandates and not having government tell us what we have to do and what we shouldn't do and what we should do. We should all have the right, to decide. That's the choice. And we really got to make sure we honor that for both sides, mask wearers, non-mask wearers, social distancers, not social distance. Everybody should be able to protect their right. Jack, do you want to respond to that as well?
That was a great example or a great explanation, Jim. This is one thing that I could probably talk about for a long time, because this is one of those topics that blows up my inbox all the time. I'll start by saying this: it's important to separate two things. And Rich, I like how you said it. There's this us versus them thing. The thing we have to remember is there's the event. The event is COVID, and COVID happened, and COVID spread, and COVID is dangerous and deadly for some, and it's taken a toll, right? But then that's the event that we really couldn't control, it seems. But then, how we responded to it. And when you look at our government leadership, starting with Fauci in the beginning, said, we don't really need to wear these masks. Actually, people fiddle with them too much. They might create more harm than they do good. The Surgeon General came out and said the same thing. And then later they flip-flopped on that, and the Surgeon General said, we should wear them, but we shouldn't mandate it, for what you just said, Rich, because it's going to create this really deep divide, and it's going to create a ton of just this, banging our heads together. Because here's what the crux of it is: who has the power to make the decisions? When you talk about the event, which is the virus, and then you talk about the response, that's the problem where I see two sides with the response. Does the government have the authority, or should the government have the right to tell everybody how to react and to respond, or should individuals maintain that autonomy? And, the governor even came out and said, we're going to mandate these. Nope. And then, we took them off, and then we went right back to the mandate. But some interest, so that's just all the theoretical stuff. But when you start digging into this, and we've heard a lot about masking and distancing being common sense. Well, I agree with that, kind of. Looking at information is also common sense. And when you look at the mask mandate in the state of Ohio, I think it was around July 24th when they were made mandatory for Ohioans. And you look at cases, hospitalizations, and deaths after that, we saw our biggest run up in cases, hospitalizations, and deaths after the mask mandate. And then you add in exactly what Terry Johnson talked about in his speech from the Senate floor on Senate Bill 22. There are areas around the country who didn't have these really strict mandates. And you look at their numbers and you go, okay, did these masks make a difference? Now we're starting to get information from the CDC. I haven't had a chance to dive into what came out over the past 24 to 48 hours. My understanding is that there's somewhere between a 1% to 2% efficacy on these masks, but they've been lauded as the thing that really staves off the virus. And unfortunately, through that entire process, we now have two classes of people because this thing has been leveraged and wielded as a political weapon. People who wear them say that, the thought is they care. People who don't wear them are tagged as the people who want to kill grandma. And it's really a shame because what that does at the heart of all of it, it takes away the ability to have intelligent, honest, and vulnerable discourse, which is what we should be having, particularly at the time of a crisis.
Great answers, guys. We're going to move on to the next question. Greg on mute. Go ahead, you're up.
Hey, gentlemen, thank you for taking time tonight. Real quick on that, some of the things that just don't add up common sense wise. You scare the American people, and then stores do it. They tell you only go one way down the aisle, or we close out these two exits and only have this one entrance that you come in. That stuff makes zero sense on fighting any of this COVID. But at the end of it, what I want to do, the best way, I hear doctors all the time tell us that, herd immunity is the best. As a child, what did we do? We had chickenpox parties. Okay, we put people together. We've got the disease. You help out the people who are less fortunate, who have maybe weaker immune systems. But then when you come up with these cases and the scientific evidence never adds up. So why is this probable cases or a false positive is still being counted? And DeWine knows this fact. And for the simple thing that we've got to sit there, he's telling us we need, 50 out of 100,000 before we can remove all the help, or we'll never get to that because that number is impossible, because today there's 4,000 and some today that were probable case. What is a probable case? I mean, either you have it or you don't. Either you're pregnant or you're not. And I don't understand the constant, and what I don't like as a governor, especially, forget that I regret it, is probably outside of voting for John McCain for president, this is probably the worst vote I ever made in my life, was voting for this guy for governor. And one of the things he talks to us like we're his father and we're the teenage children. Don't lecture me. I'm not here. I raised my family. I didn't build tons of money out of First Energy to get rich. I did it because I built my business and I built myself up. So, with this, and why is nobody questioning that? I see the citizens. I don't see a representative. I don't see a state senator. Where does probable come in? I've never heard of that in my life. I mean, is this 2 a.m.?
Well, hey, Greg, thank you for your question. And you're right. I mean, I don't watch the governor anymore. I get tired of feeling like he's telling me like I'm a little kid. And but I've heard that multiple times from so many people. I think the governor would be best by just not getting on the TV anymore, doing what he believes right. And because every day he gets on, he does make people upset. But I would agree with you. I don't think we'll ever get to those numbers. I think Jack will have some insight on this too, because I know he was looking into that as well. But, the bar that he sets, he keeps setting bars. And by the way, election time is coming. So if you notice what happens with especially career politicians, they're very smart. When they know their re-election's coming, they start to move back toward in this case, the governor, who is very much left center, is now moving back to the right, slowly back to the right, because he's trying to make sure that people hopefully re-elect him. And that's the issue when you say, 50 out of 100,000 or whatever those numbers are that he put out there. he can set the bar anywhere he wants. He knows that in the end, he's going to do what he wants. And that's what is frustrating people. So I 100% agree with you. I think he has set a bar that will never be reached because it gives him the authority to continue to do what he's doing. Jack, I don't know what your thoughts are.
I have a lot of thoughts. Again, this is one of those things because early on in the pandemic, I was caught up in this process of research and reporting on cases and what justified a case and what's the difference between a PCR test and an antigen test. And based on the number of infections that you have in a community, how reliable is a PCR test or an antigen test. And what we learned through all of that is that there is a false positive rate. There's also a false negative rate. So those tests aren't perfect. And, the New York Times ran an interesting article about because of cycle thresholds, which all that means is the number of cycles that they run in order to test what they pull as a sample. When those cycle thresholds were high, the New York Times said 97% of cases in some instances were false results. So when you start to look at that, and cases are one of the metrics driving your policy making, it really causes a lot of heartburn for people. And that's what I've heard a lot from Ohioans is, well, how do we even know these tests are accurate? Because we've seen study after study after study. In fact, Governor DeWine returned a false positive when he went to visit the president last year. We've heard NFL teams who had multiple people test positive. They went and took, multiple tests after, and those were false tests. I mean, we just heard it again and again and again and again. And so now we're in this position where he said, look, after we have 50, get it down to per capita 50 per 100,000 people, we'll let go of the restrictions. But today during the presser, and I don't have the numbers in front of me, he listed all of the cases per 100,000 from going back to March of last year. And early on, which by the way, that's when people were going, wait a minute, we're not seeing this virus the way that we were told it was going to show up. Why can't we let these, why can't we be free from these restrictions? It was in those months early on that we were actually below 50 cases per 100,000. But, there are a lot of people who question the integrity or the reliability of the tests. And then they also look at it and say, well, wait a minute, even if somebody tests positive, for example, Ohio State University now has increased their testing to twice a week for students. What happened after that happened? The football team had to subsequently cancel their practices because they had a certain number of positive tests crop up. So, and then today, that was one of the other bugaboos is that DeWine said, hey, we're getting closer to that 50 per 100,000. But oh, by the way, don't forget about the hundreds of thousands of at-home antigen tests that you can pick up at these federal locations, at the library, at schools, and at your local health department. So, when people look at cases right now, the feedback I'm getting, the pulse I have is that they're going, hey, hospitals aren't full. And in the beginning, that's what this is about. That's what this was about. We need to be able to go about life normal, not new normal, but normal.
Great answers. That very hot button question. Let's move on to Sam. Go ahead and unmute and get your question in.
Hi, Sam.
Yeah, this is Mr. Renacci. I just want to say I like the straight truth from my elected officials. I don't know who the guy was. I didn't catch his name that called before me, but I just want to tell him I feel your pain. I watched DeWine and Husted, and I voted for them too. And they get on their little soapbox TV thing, and they always have this silly little story, oh God, I feel bad for this person, okay? And it irritates me. And you guys were talking about mental health earlier, and I was hoping I was going to get called to ask a question because that mental health is very important to me. And a good friend of mine, his daughter was going through rehab for opioid addiction. She's got 2 kids, and she was locked down with her 2 kids. She fell into depression. And a month ago, she tried to commit suicide. And she's in a rehab facility now, but nobody talks about the effects of the lockdown. And it was weird today, actually, I heard on the radio, they were talking about how the effects of these lockdowns are now causing mental illness in kids, especially those that are in school. And I know a lot about mental illness, and they say most mental illnesses are caused up to the age of 15. And I just want the blunt truth from my elected officials, not this sweet, oh, let me tell you a sweet story. I'm going to quote you a great quote from a famous leader. Just what can we do, Mr. Renacci?
Well, hey, Sam, thank you for the story, and thank you for bringing that mental health story to the forefront. This is an issue, and I agree with you. The biggest problem with many of our elected officials, they've never had to suffer through the loss of a job, the loss of no income. I mean, do you think the governor or even Lieutenant Governor Husted, and I'm sure there are people on this call tonight that are going to report this fact, had they had to take a pay cut in the last 2 years? Have they had to have their pay reduced, or were they worried about making additional, how they were going to make ends meet? That didn't happen. These are the stories, whether it's loss of jobs, whether it's mental health. These are the inflictions that are caused by the lockdowns. And I absolutely agree with you. Look, people will call me a politician because I ran for office. But the truth of it is, I really don't like politicians, because if you are a career politician, you're only worried about the next election. You're really, and that's exactly what DeWine and Husted are worried about right now. They're not worried about anything but the next election. You'll start to see them make moves that'll get them to try and be able to get reelected. Because look, if there was a reelection of those individuals today, they probably would not win. The problem is they've got 14 months to change things. So politicians will always tell you the story you want to hear so that they get reelected. And they'll tell you these little sidebars to make you feel like they feel your pain, but they've never really had to live through your pain. I guarantee you, myself, Jack, others, I know what it's like not to be able to get a pay. I know what it's like to barely make ends meet. I know what it's like to struggle where you wonder how you're going to pay your bills and make things happen. That's all part of life outside of politics and politicians. But these individuals that basically are career politicians, they've never had to live with that. And all they can do is tell you those little side stories. Jack, I don't know if you have a comment.
Yeah, Sam, thank you for having the courage to share that story. It sounded like it was tough. I can only imagine. I heard a similar story of someone who had, for a long time battled the demon of addiction, and during this response succumbed to a suicide attempt. And those stories are hard to hear. But when you think about the effects, you say that you want the truth, you want something shared with you that's accurate and transparent. There's two sides to that coin, and I'll tell you what I mean by that. Several months back, I was talking with a medical data analyst who had the chance to talk with the governor's administration and then the Ohio Department of Health, and provide some significant input at times that they were, still putting things together with respect to the state's response and what they report and what they don't report. And, one of the things that he shared with me really privately, and then I think eventually he shared it publicly, was that during the course of conversations with both the administration and the Department of Health, what he uncovered was that, epidemiologists, they're professionals. And I think one of the things that they're trained to do is to really share the worst case scenario and then make sure that we're all being uber conservative so that we're not casting off restraint to cause more, harm to ourselves or to our community. But the challenge with that then is, we get a part of the story, and sometimes we get the part that may be the scariest part or maybe the worst part, but we don't get the other parts. Many people have said to me, why doesn't he take a moment to put someone on the screen that lost a business? Or why doesn't he talk to a parent who has a child who is atypical and needs to be in the classroom or can't wear a mask? These are all people. These are all Ohioans that are under the leadership of this administration. And it is frustrating for many Ohioans who write me and call me that we don't get to see that side of the picture. That certainly doesn't mean that people who are dying of COVID and sick and getting very sick and suffering, it's not that they're not important, it's that we're all important. And that's why the magnitude of the decisions and the policies that we put in place right now are so important.
Thanks for that story, Sam. It's kind of tough to move on from something like that, but we're going to move to Cynthia. Cynthia, go ahead and unmute and ask your question.
Hi, Cynthia.
Cynthia Richards. You have to hit the unmute. We'll give her a second. We'll move on to Linda, so we can get her up. Yeah, Linda, you're up. If you want to hit the unmute, Linda LeBeau, go ahead and ask your question.
Hi, Linda.
Linda, you have to unmute.
We have a long list of people with questions. So we can keep.
I know.
Moving
I know.
on.
Sometimes it's difficult. You don't realize that you're muted.
Yeah, I think there's a pop-up box that may show up that you have to click on.
Yep. So let's go to
Sarah.
Sarah Simon. She found the unmute. Go ahead, Sarah.
I did find the unmute. I'm multitasking, making dinner. Yeah, my concern was, question I wanted to raise is I kept my kids home for remote. They're in 7th and 8th grade for the year, basically. And testing is coming up. And I've been getting emails that they need to go in person. And I thought that was kind of a slap in the face for doing, God bless me, remote learning for a year with 2 teenage boys. And I was curious of thoughts on that aspect of it. And I kept them home for 2 reasons. One, if this virus is so detrimental that you have to mask small children for 40 hours a week, there's a high risk there, so why as a mother would I put my child in that position? And secondly, from a mask perspective, I don't think that we know the long-term mental or physical effects of that. And I was fortunate enough to be in a position where I could do that because I work remotely. But I was just a little bit, I wanted to throw that out there because I think that going an entire year doing remote learning and then the state coming in and saying, hey, your kid needs to come in person for a test, like the rules seem to be a little bit gray here on the virus. So.
Well, Sarah, it's interesting. You have the ability to stay home, it sounds like, and work remote. That gives you that opportunity to have your kids at home and be able to watch over them as they're learning at home. I get concerned to those who can't stay at home, and there's a percentage of individuals who really can't stay at home. They have to go to work. And that has caused some of the unemployment numbers because they had to stay home with their kids. And I understand that. Education for their kids was important as well. But that's the other side of that coin. But look, I think in the end, we have to be able to evaluate the risk. I think when we all went to school, there were probably risks. And COVID, I'm not sure is a risk that would rise to the level of death to our kids in school. So I guess we got to compare those risks to the risk, the mental health risks that we already heard about, to some of the issues that face those individuals who don't get a chance to go back to school. But I think in the end, it really comes down to rights. And if you want your children to stay at home and be remotely learn at home, that should be a choice you make as well. So I think this is really the key. It's not about what the government shouldn't tell us, this is what you have to do. You should have the choice of what you want to do. Jack, you have anything to add there?
Well, other than Sarah's is what I would call a super mom, when you're able to keep your kids at home for a year and, aid them and guide them in their education, that's a pretty awesome thing. It's a big role. I have an 8-year-old and I have my hands full. So I can't imagine, all the hard work that Sarah's had to put in. And I hope that it was Sarah. I didn't hear clearly her name at the beginning. So if it isn't Sarah, I do apologize. But I guess all that I would add is I agree with what Jim said. I know some school districts are allowing you to learn remotely. And if that's something that makes you feel safe and secure, and I think most districts will give you that right. I know that the governor has worked very diligently, particularly through the month of February, to make sure that school districts had teachers vaccinated, which kids generally aren't carrying the virus forward. And the fact that most school districts now have their teachers and employees and staff vaccinated, I think just kind of gives you that extra level of protection there. And then, if I think you said that you're trying to get them tested, as I mentioned earlier, apparently there are at-home rapid tests that you can pick up. So I would call your local health department to find out if you're able to get your hands on one of those, if you're uncomfortable going, into the public setting to get them tested. A good question.
Great point. Now we're going to move on to Tamara. Then we'll try Linda and Cynthia again. So Tamara, unmute and go ahead.
Thanks,
Hi, Tamara.
Tom. You're the first person that's ever pronounced my name correctly.
It was a good guess.
I'm from Wapakoneta, Ohio, and I don't have any children, and I did not lose my job. I did not lose my business, but I lost my husband in a nursing home alone. Now, the CDC put out new rules today about nursing homes that were so confusing, even our governor did not understand what they were. And I do know that there's a bill on the House floor, Bill HB 120, I think it is, regarding designating people as a compassionate caregiver. And I was just wondering about, the people in the nursing homes are dying from isolation, depression, failure to thrive. And I had to say goodbye to my husband through a window. And I would just like to know if you have any thoughts or comments about what us families can do to maybe push the nursing homes who don't want to relinquish visitation rights.
Well, Tamara, thank you for that story as well. That's another effect of the shutdowns and closures. I will tell you that I was in the nursing home business. I still own a nursing home. I can also tell you that the most devastating thing for me was to realize that the clients and patients and residents were not able to see their family. I think that was one of the biggest mistakes this governor made. Look, other states said, and the Florida governor said that he realized that the most vulnerable people, and we've learned that now, the most vulnerable were in the nursing homes. And what he did was he went in and made sure they were vaccinated first. That was a priority. That's probably one of the biggest mistakes this governor made, because when he was looking at shutdowns and closures and all the issues where he was trying to clamp down on people, what he should have done, in my opinion, was said, I want to make sure we protect the most vulnerable, which would have been the nursing homes. If you look at the percentage of nursing home patients that are part of those that have passed, it is I think it's 42 or 44%, might even be higher in some states, of people that have passed away in nursing homes because they were not given the priority they needed. And in many cases, that would have been the easiest thing for this governor or any governor to do, was to make sure that all nursing home patients and all staff were vaccinated and prioritized. Instead, what we did is we isolated, and you're exactly right. We had so many people who had to pass away in isolation or only see their family through a window. A very, very terrible situation, and something that I think should have been addressed immediately. So look, that's another story of yours that brings tears to people's eyes, and is something that to die alone in a nursing home or even in a hospital was a terrible, terrible thing. And I think we could have done better. Jack?
Yeah, that's a really tough topic. That is one of the things we knew from the beginning, that our aged population, particularly in congregate settings, we're going to be at a heightened risk. But a couple of the things that I've learned through this process over the last year, what I'll start with is my dad, and my dad's one of my superheroes in this life, and my mom's another one. But my dad went through a health crisis several years back, and I'll never forget being there during that crisis and being able to advocate on his behalf, and being able to provide encouragement, and he's in a fantastic place now. He's recovered, and we're grateful. But I think about the people who had loved ones in nursing homes and weren't able to be there to advocate and just make sure, because in some situations people aren't able to clearly articulate what they need or get a second set of eyes on what's going on. And so that's one of those things that many Ohioans have struggled with. And then we heard about this heartache syndrome where people literally were dying because they lacked human touch and human interaction. And the other thing that was interesting to me, and again, I want to say thank you for that question. And I'm very sorry for your loss. And I pray that you'll have peace through this time. The other thing that was really interesting to me was the way we studied and talked about therapeutic drugs. Early studies, although they weren't conclusive, showed that there were therapeutic interventions that if they were administered early in the virus, that would make a difference. And I vividly remember a conversation I had with a healthcare worker. She was over 70 years of age, and despite wearing a mask, gloves, wiping down surfaces, and taking all the recommended measures, she got the virus. She and her husband both. She proactively checked herself into the hospital. She started to decline, and she requested an anti-malaria drug, an anticoagulant, and pharmaceutical doses of zinc. Now, I'm not a doctor, so I'm not prescribing that. I'm just telling you what she shared with me in the report. And then she said she felt better immediately. And there are certain things that got politicized that I felt like we weren't really proactively providing for people that might have been at the gravest risk. And I remember talking to a Tuscarawas County family where the father of that family started to fall ill, knew he contracted COVID, and at the time he requested therapeutic intervention. Now, he wasn't in a nursing home; he was probably in his late 40s, and he was denied. And he was told, you have to be hospitalized to receive that kind of care. Well, about 5 days later, he actually did have to go to the hospital, where they gave him what he requested early on in his battle with the virus, and then he recovered. So that, to me, is one of those things that I think we'll look back on and go, were we doing our absolute best with the therapeutic opportunities that we could have maybe used early on in the virus? Not a doctor, not pretending to be, but I've heard so many stories from professionals that's one of those things that will linger in my mind a long time.
And just one last thing. My mother's 94 years old. I still go and visit her all the time. There's not a time that she doesn't say, "Can I just get a hug?" I mean, that's the kind of thing that people many times, I don't think they realize the effect of that we have not been hugging, and especially the elderly. So again, thank you for that story.
Yeah, thank you. We're going to try to get 2 or 3 more questions in here quick. So guys, please be brief. We're going to move on to Elaine.
Hi, good evening. Can
Hi,
you hear me?
Elaine. Yes.
I'm talking to you as a registered nurse. I'm a former chief nursing officer and also a licensed nursing home administrator. And in looking at what's transpired over the past year, our governor has not done right by the state of Ohio, from my perspective. Our healthcare systems, have hijacked COVID to the detriment of our population. There's really no reason why families were taken away from being with their loved ones. We've been gowning and masking and gloving and putting booties on for isolation forever. In speaking to some of the doctors at some of the major hospitals in Cleveland, we're going in and out readily with simply a mask, going home to their families, coming back in. There really was no reason for the atrocities that took place. And I'm really ashamed of the people that were in hospitals that kept families away from each other. I need to say that. That being said, other states are going after their governors, all right, when our legislative bodies are either ineffective or cannot lift these lockdowns in a timely manner. So my question is there a method or a process to either impeach or get this governor out of office? And what can the population to do to end this lockdown? Because you know as well as I do, he's not going to lift anything. And it's going to be delayed by another 30 days by way of this bill in this assembly. And then there'll be another delay, et cetera, et cetera. And how much more does the population have to withstand? There are approximately 14 to 15 states that have lifted their mandates and their masking and made it optional for people. So we have to get over this COVID.
Right. Elaine, thank you for your question. I will tell you that there is nothing in Ohio law that allows for a recall of the governor or an impeachment of the governor. For these issues. And I think that now, of course, high crimes and misdemeanors is always the impeachable standard, but we don't have a recall. The only recall we have is every 4 years. There's an election for a new governor. And I think at that point in time, people will have to remember what he did and make that decision. The reason we keep talking about these things is because people forget. And we need to make sure that we continue to talk about what happened when the voting time comes around, because too often we say, well, it's better today. Well, it's always going to be better 14 months from now, but could it have been much better if things were done different? And I think that's where we have to be very cautious.
Jack, any thoughts on that?
Well, Elaine, thank you for sharing, and thank you for sharing with us your background and your professional credentials. That it's very meaningful. I know that we're going to try to get a lot of questions in, but impeachment is the route that you can go. There were a handful of lawmakers that attempted that last year, who are Republicans, because Republicans are in the majority in the House and in the Senate. But that was met by harsh criticism by the then chairperson of the Ohio Republican Party. And so I think, one of the things that is probably not going to happen is that there's not going to be a group of lawmakers who are Republicans in the supermajority that are going to impeach a Republican governor. I just don't think it's going to happen. I think behind closed doors, some of them will tell you that they're not happy with what's going on. But at the same time, they've also, we've spent a year and there really hasn't been legislation that limits his, the power that doesn't have scope or duration right now. Nothing has happened through the course of a year. It looks like Senate Bill 22 will happen, and they will have the authority, to immediately take down health orders. It's not the state of emergency under which the governor did most of the, things that people are upset about with the emergency order that affected daycares and liquor establishments. Most of the controversial things happened under health orders. They'll have the ability to do that, but then again, it takes a Speaker of the House and a Senate President to bring those concurrent resolutions to the floor and get a vote. So, as Jim said, the referendum is going to be probably at the ballot box in 2022.
Yeah, and I do want to add, I said there's no ability to impeach. I meant when I said that what Jack just said, you're never going to get enough lawmakers to impeach. There really is no mechanism. I wish there was. There has to be a serious high crime and misdemeanor. Otherwise, and I know we had Representative Becker who tried to get this done with DeWine, but you know, most people are more concerned about their next election than doing what's right in many cases, and that's why impeachment fails.
This hour has flown by. We're going to squeeze in one last question, and then Jack, after that, we'll let you wrap up for a minute, and then we'll close up with Jim. So our last question tonight will be from Tammy Mackey.
Hi, Tammy.
Hello. Hey, thank you guys for doing this. I believe her name was Elaine. I just was glad that she came on because she was talking about how, you know, the doctors go in and out. But if this quote unquote virus is so bad, why don't we have specific containers that we go and drop off masks at? I mean, I can take my medication that I don't use any longer and drop it off at a specific police department and dump it down in a container and they come and take it. Back in March of last year, I was deathly sick. They said I had the COVID, scared the crap out of me. In my opinion, I feel like it's just another strain of the flu. You know, I watched, you know, Mike DeWine keeps throwing these videos out there about, he's more or less just, you know, shoving the shots down people's throat. Well, I visited this place. I mean, he must have did what, 4 in the last 2 days. But it's funny because when Mike DeWine took his shot, you know, they didn't wipe him for, you know, any dabs of blood. They didn't put a Band-Aid. I'm like, I really don't even think this man took this shot. But I got a couple of questions. And one is what can we do with DeWine? What can we do with the nursing homes? Is he being investigated at all? Does he have any affiliation with the nursing home deaths? The gun laws that passed or that they sent over today, is that going to affect us as gun owners? Is Ohio doing anything to set in their own laws, like fighting the freedom of speech, you know, our gun laws, welfare for immigrants, you know, things that Texas is doing? Are we following along with all of that?
Well, Tammy, real quickly, the governor could, he's not. Look, the governor came out last year and said that he wants to bring refugees into the state of Ohio. These are all the things that most people don't believe a Republican would ever say. And by the way, the chairman of the Ohio Republican Party agreed with him when I came out and said that Republicans don't support that. But in the end, some of your issues, states, I've said this time and time again, the biggest problem we have is that states granted the federal government limited powers a few hundred years ago. And now we have a federal government who has taken absolute power. Yes, the gun bill just passed the House of Representatives. I doubt it'll pass the Senate. But if it did, the state should become a sanctuary state when it comes to gun rights. We should protect ourselves. You know, when it comes to refugee resettlements, we should protect ourselves. We should run as a state and compete with 49 other states. It's one of the problems we've had with the past few governors, that they didn't really look at, they are running a state. They should be growing a state, competing with 49 other states, making the state a place that you want to come and grow and live and raise a family, making it one of the best places in our country to live, grow, and raise a family. None of that's ever talked about. Instead, it's COVID this, it's COVID that. I've said, if you're a leader, you've got to make decisions. And sometimes those decisions people may not like, but they've got to be in the best interest of future generations, not in the best interest of the next election. So the answer to your question is, a governor does have the ability to make its state strong and to be able to protect its rights over the federal government. It's something that this state should be doing and preparing for. Jack, I don't know if you want to add anything.
Jim, I'm not going to follow that. That was a fantastic answer.
Great. Thanks everyone for the questions. We are short on time here. That was a very quick hour of questions. Jack, you want to have some closing thoughts, then we'll roll over to Jim to wrap it up.
Sure. First of all, I just want to reiterate, I'm humbled at the opportunity to be able to to be here and share in this forum. And so thank you, Tom and Jim, thank you for choosing me and having this open, candid conversation. And I guess the thing that I'll say, just speaking off the cuff and probably from my heart, is the greatest risk is the unwillingness to take a risk. And I think the biggest challenge before us right now as Ohioans is a challenge that we face as people. And that is, we have to take a risk, and we have to be willing to be wrong. We have to be willing to be vulnerable, and we have to be willing to work together to overcome problems that are way more substantial than we understand them to be right now. Jim talked earlier about how the economy has been propped up by one-time payments. And of course, some folks were getting some extra in their paycheck while they were unemployed. That will eventually go away. And unless that's followed by an uptick in production, real production and real consumption, there's going to be an economic tail to this that's probably going to be worse than the health tail to it. So, above all else, we're going to have to learn how to come together. We're going to have to learn how to love each other. We're going to have to learn how to accept differing viewpoints and figure out how in the world we're going to work together to get through this, not only surviving, but prospering and thriving again.
Well, thank you, Jack, for being with us tonight. We appreciate your insight, love some of your comments, and I'm sure most of the people who are on this tonight appreciate it as well. Look, this is our 5th town hall. This is about issues. This is about making sure people get the facts. This is about also listening. It's the one thing elected officials and especially career politicians don't do. They don't listen. And it's good to be able to open up for an hour, take questions, and hear people's concerns. But here's what we have to do. Look, I heard about recalls. I've heard about impeachments. I've heard all of those things. There is an election coming up in less than 2 years. And that's when politicians in the state house, in the federal government, across our country have to be accountable to the voters. The problem is we forget, and we shouldn't forget. If you don't forget, you'll remember all the things that were taken away from you over the last 2 years, and you won't reelect the people that took them away from you. Money in politics there'll be money in politics that will try and convince you that things didn't happen last year, they didn't happen last month, but in the end, you all know what happened. And if we remember, the best way to impeach, the best way to recall is in an election booth next year. We're going to continue to have these type of discussions. Every 2 weeks, it's about a different topic. You can join the team. We'd love to have you on the team by going to jimrenacci.com/join, step up. We're looking for captains. And when I say captains, that's just people with a voice that are willing to talk about the issues that we're talking about. We can change it and make a movement. Or join us on facebook.com/jimrenacci. These are things on the screen, twitter.com/jimrenacci. But one thing, just be willing to step up, as Jack said, and make a difference. In the voting booth, you can get that done. Again, I want to thank you for being on tonight. I think this was a great discussion. Thank you for your willingness to spend some time with Jack and I. God bless you. God bless Ohio. And God bless this great country, the United States.
Good night. Thank you.